critic about the COVID-19 in the Philippines. Since the emergence of the COVID-19 pandemic, the number of cases have already reached 82 million worldwide at the end of 2020. And in the Philippines, the number of cases exceeded for about 473,000. And some countries around the world face the continuing threat of the COVID-19 pandemic. National governments and health ministries formulate, implement, and revise health policies and standards based on recommendation by our World Health Organizations, experiences of other countries, and on-the-ground experiences. Early health measures were primarily aimed at preventing and reducing transmissions in populations at risk. And these measures differ in scale and speed among countries, as some countries have more resources and are more prepared in terms of healthcare capacity and availability of stringent policies. And especially during the first month of the pandemic, several countries struggled to find tolerable, if not the most effective way or measures to flatten the COVID-19 epidemic curve to so that health facilities will not be overwhelmed. And in responding to the threat of the pandemic, public health policies, including the epidemiological and socioeconomic factors. And the success or failure of these policies expose the strengths and weaknesses of the governments as well as the range of inequalities in the society. And as national governments also implemented large-scale blanket policies to control the pandemic, local government units such as LGUs have to consider granular policies as well as a real-time intervention to address differences in the local COVID-19 transmission dynamics due to heterogeneity and diversity in communities. Some policies also in place, such as a voluntary physical distancing, wearing a face mask, face shield, mass testing, and school closures are one of the effective ways in one locality but not on the another. And also, subnational governments like LGUs are confronted with a health crisis that have economic, social, and fiscal impact, while urban areas have been hotspots of the COVID-19 pandemic, and there are health facilities also that are already well prepared in place as compared to some places in less developed and deprived rural communities. And lastly, the importance of local narratives in addressing subnational concerns are apparent from published experiences in the United States, China, and India. Thank you.